What's up, guys? How's it going? Cade Moore with More Muscle. I am a nursing student. I want to become a doctor. And today we're going to be talking about iron deficiency anemia. Guys, iron deficiency anemia is very problematic, can cause some serious problems, and it's something that you want to get taken care of right away. There are many ways that you can prevent this disease, but let's get started. We're going to go ahead and talk about how that works and everything about iron anemia. Guys, red blood cells, they carry oxygen throughout the body, and your body needs iron heme to carry this oxygen around the body. And when it doesn't have enough iron, the body can't, that oxygen is not going to go through the body, right? So your body needs the iron for the red blood cells to carry the oxygen. So some symptoms, guys: you're going to feel fatigue, chills, shortness of breath, weakness, chest pain, difficulty concentrating, dizziness, bruises, pica. Guys, pica is a condition where people crave non-food items like ice, soap, chalk, paint, clay, stuff that's not food, right? And sometimes you think that your body has that pica because you're craving iron, you're craving dirt, something that might have iron in it. But in reality, a lot of those things that you crave don't even have any nutritional, value. So pica is that condition where you crave non-food items. And like ice, guys, ice is usually, when you're constantly craving ice, that could be a sign of iron deficiency anemia. Headaches, guys, is another symptom. Restless leg syndrome. But guys, the main ones you want to focus on is fatigue. Fatigue is the biggest one for iron anemia deficiency. So when you're extremely fatigued, that's what it's gonna, that's the symptom to look for, and that might lead to that, right? The next one, guys, why does this happen? Why does iron deficiency anemia happen? Well, the first reason, you might not be eating any iron. You might not be eating healthy foods which have iron in them. The next thing is you could be bleeding. You could have colon cancer, a GI bleed, gastrointestinal bleed. If you're taking too many like NSAIDs or ibuprofen or naproxen or anything like that, that can actually damage your stomach and cause you to bleed, make you lose blood. And if you have black tarry stools like poop, that could be blood. So if you ever do see that, then that's something you want to go to the doctor and get checked up on. The next thing, guys, bleeding in your urinary tract infection, bloody loss to injury or surgery, heavy menstrual periods, frequent blood donation, frequent blood test. This is especially true for all infants and small children who have many blood tests. So guys, there was one time I was working in the ICU, and we had to do like 2 or 3 blood draws, and that's like big, like basically tubes this big, and we had to do like 2 or 3 of those of like 6 different types of blood tests. And this patient lost a lot of blood within those, because the results kept on coming back, and they were like skewed up. They were messed up for some reason. I don't know how, but we had to do like 2 or 3. That person lost a lot of blood. So guys, when you lose a lot of blood, you need to get that iron. You need because you lose a lot of iron, guys. So say, for example, if you crash on your motorcycle, you cut up your arm, you're bleeding a lot, you need to get iron in, or else your body's not going to be able to perfuse oxygen as well. So guys, if you're bleeding, you're at risk for iron deficiency anemia. So guys, the next thing, guys, we're going to talk about ferritin. So ferritin is a test where you can actually check your iron levels, right? So ferritin is one of those tests that you'll get. And another thing, guys, is iron risk factors usually can be a big problem is weight loss, like unhealthy weight loss, or like malnourished. Those can be other causes of iron deficiency anemia, guys. The next one is you might get an H&H test. So an H&H test is a hematocrit test. It just tells you the percentage of red blood cells in your blood. And red blood cells are important because they're going to carry oxygen throughout your body. So the next thing is the ferritin test, like I mentioned. A ferritin test in your measures the protein that stores iron inside of your cells. So this test can help providers determine if you have healthy amount of iron in your body. So yeah, guys, you want that ferritin test, that hematocrit test. Let's get into it, guys. So if you're pregnant, you're at risk for this. There's actually a lot of gestational iron deficiency anemia, which is like when you're pregnant. So there's prenatal vitamins that have 30 milligrams of iron. Now let's talk about some other foods. If you're not pregnant or if you just want to do it naturally, let's talk about some foods that have iron in them. So guys, 6 ounces of steak has 9.3 milligrams of iron. It's a lot. 3 ounces servings of oysters have about 7.8 milligrams of iron. Dried fruit, about a cup, have about 7.5 milligrams of iron. White beans per cup have about 6.6 milligrams of iron per cup. Spinach has 6.4 milligrams of iron per cup cooked. Unsweetened dark chocolate has about 5 milligrams of iron per ounce. Quinoa has about 2.8 milligrams per cup. And mushrooms have about 2.7 milligrams of iron per cup. Squash and pumpkin seeds have about 2.5 milligrams of iron per 1 ounce. So guys, if you're eating healthy, you shouldn't have a problem with iron unless you're, bleeding excessively or if you have other problems. I think if you're pregnant, it might be a good idea to supplement iron, although iron can have some constipation effects and some other unwanted side effects. But guys, 27 milligrams is the recommended daily amount for adults. So younger kids, you don't want to have, younger kids, there's a lot less. But for adults, 27 milligrams a day is adequate. If you even just eat 2 cups of fruit and 2 cups of vegetables, you'll probably get the amount of iron that you need for the whole day. But if you're eating constantly processed foods and foods that don't have nutrition, you might be lacking iron naturally. So guys, for example, if iron deficiency anemia is present, you might need about 60 to 120 milligrams a day. So that means you might need a supplement if you're already iron deficient anemia. If you already have it, you might need to take some iron. And then severe anemic patients can receive blood transfusions, and that might help. But anyways, guys, this is interesting. Hopefully you enjoyed it. Eat those healthy foods. If you eat those healthy foods and you don't have any bleeding problems, then you'll be okay with iron. Because if you're eating healthy foods have an adequate amount of iron, and you shouldn't have to worry about it. But anyways, guys, thank you for watching. Hopefully you learned something. Subscribe, follow, comment, whatever you want to do. Thanks.